Hello sir, I am Dr. Malik, anesthetist. I have been making regularly videos. I wanted to talk about a small topic about spinal anesthesia. There are different types of anesthesia we give for different patients, and spinal anesthesia, which is given to the backbone, a small injection into the backbone, injected into this. There is a fluid called cerebrospinal fluid inside. Inside the backbone, there will be a fluid passing from the brain that is called cerebrospinal fluid. We inject a small drug into the local anesthetic drug into the cerebrospinal fluid. So through this spinal anesthesia, we give through a 26 gauge very fine needle, we go inside, we inject the drug into the cerebrospinal fluid, so that any operation below the umbilicus, so you can cesareans, any orthopedic injuries to the legs or hip, these are all they can be done safe. And urology procedures like urethral and prostate surgeries, etc. About 50% of the operations below the umbilicus can be done under spinal anesthesia, which is the safest anesthesia even today, everywhere, even in UK, every place. Spinal anesthesia is the best anesthesia, but some myths are there regarding spinal anesthesia. What people ask us generally on the table when I am trying to give an injection, they say, sir, see, already I underwent once, I have had a backache now, will it aggravate the backache? No. See, this is very simple. This is the finest needle which goes inside, makes a very small rent, very small hole inside, and that hole seals off in about 48 hours. So at the most, the patient can have little headache first day or second day. Particularly when the patient sits, and when the patient is standing or sitting, they may have little headache for the first 48 hours, which can be relieved by simple taking more fluids and lying down position. 48 hours, please lie down. Don't get up and don't walk for the first 48 hours. Limitedly. You can do it, you can go to the toilet, etc., but limitedly. And at the same time, you can take very mild analgesics like paracetamol, Dolo 650 or whatever it is, and you can get relieved. So that also develops in 2 out of 10. Suppose we give about 10 patients, we give spinal anesthesia. 2 people complain of post-spinal headache for first 24 hours to 48 hours. Very rarely the headache continues. Very, very rare, impossible. So only very rarely I have seen once or twice. For that we have other methods to follow to control that headache called post some extradural patch, etc. But that is a very rare situation. We see 1 in 10,000 like that. Okay. So what I feel is, please don't hesitate in taking a spinal injection, particularly when you are undergoing a surgery. If the anesthetist decides to give a spinal anesthesia into the back, into the spinal, don't hesitate, because that is the safest anesthesia for you, but for that particular surgery, because the general anesthesia or any other anesthesia may be risky for you at that time. So please don't hesitate. Whatever anesthesia is decided by the anesthesiologist, he is a qualified man, he has studied for 3 years, he has been working for a long time. Whatever he feels, let him give. Don't hesitate for spinal anesthesia. It is the safest. It never causes permanent backaches or anything like that. It's a very small, it is not an injury at all. It's a fine needle which goes inside and heals within 2 days. That rent we create will just heal in 2 days.